Yo RBs, welcome back to another video, and today we are reacting again. Surprise, surprise, we are reacting to a video. Times you've almost died without even knowing it. Right, this sounds a bit crazy already, so let's see what times we've actually nearly died. Maybe you've done it before. Maybe I've done it before. Let's see. Let's get into the video.
Cautionary tale of cracking your neck, choking on plain old water, even holding in a sneeze. What? Today we're talking about everyday habits and accidents that look harmless on the outside, but can be terrifying and even deadly.
Oh, so we've got an actual doctor. Sorry,
Cracking your neck. That satisfying pop after a long day of staring at your phone feels amazing until it's potentially deadly. Twist too hard or put pressure in the wrong spot and you can tear one of the arteries in your neck. That tear.
I will admit I crack my neck quite a lot 'cause it's always in discomfort. Maybe I should go to the doctors about that. Yeah. Hopefully I never do that. Fingers crossed, touch wood. Let's hope I don't do that. Especially not on live. Really, yeah.
It's called a vertebral artery dissection, and while rare, it is not rare enough. It accounts for up to a quarter of strokes in young adults. And the scary part is how ordinary it looks. 1 second you're cracking your neck, and the next second you're dizzy, slurring your words, and even collapsing. Chiropractors themselves, too, have to be very careful with neck manipulations for this exact reason. The good news is,
chiropractors scare me. Honestly, all of a sudden, they're just cracking your bones just casually. And all of a sudden, you could just pop like something out of place. I don't know how I feel about chiropractors. That's the problem. They crack bones too easily. I just don't like it.
Early treatment is usually blood thinners to keep the clot from traveling, or in some cases, emergent surgery. Number 2, choking on water. Everyone's had that moment where water goes down the wrong pipe, right?
Yeah.
You cough, your friends laugh, and usually that's the end of it.
Why would you die from choking on water, though? Would you drown? Sorry. Well, what? I'm gonna drink my drink while I'm at it. I didn't choke.
But the truth is, when liquid slips past the airway's defenses and makes it into your lungs, the story doesn't always stop there, and could possibly take a tragic
turn. That's
that stray sip can carry mouth bacteria into the lungs, setting the stage for aspiration pneumonia, a type of lung infection that can spiral into fever, chest pain, and in severe cases,
oh, Mr. Bean's on that. Sorry.
If oxygen is cut off, the countdown is brutal. Brain cells start dying in about 4 minutes.
Yeah, but you breathe when you're coughing.
Number 3, standing up too fast. Ever stood up too
fast? Standing up too fast can kill you. I do that quite a lot. I stand up too fast, I go, whoa. But since when could standing up too fast kill you?
Well, like the floor just disappeared. That's orthostatic hypotension.
That's too big of a word for me to say.
Drops, leaving your brain starving for oxygen. Usually it's a quick head rush, maybe a little black vignette, but sometimes your body cannot recover fast enough. That's when you faint, you fall, and if you hit your head on the way down, it could be game over. Treatment?
Yeah, but you're saying it on the topic of standing up, not on the topic of if you fall and hit your head on something. That's common sense. If you hit your head too hard, that does a lot of damage. But it's not like just standing up. Yes, you get dizzy and all that. Sometimes you have to sit back down. But yes, it's common sense if you hurt yourself from fainting or falling over. You can do a bit of damage.
Sometimes it's as simple as standing up slower, drinking more fluids, or adding a little salt to your diet so your blood body stays higher. If dehydration or anemia is a culprit, IV fluids or treatment for the underlying issue can stabilize things quickly. So while most people laugh off the woozy feeling, it's your body sending you a very clear message. Don't ignore me. Number 4 is sleep apnea. You think sleep is safe, a time for your body to heal and relax, but for people with sleep apnea, every night can be a battle and one step closer to potential. fuck it. You see, the airway closes off, oxygen levels plummet, and the brain jolts you awake in a panic. This can happen dozens, even hundreds of times each night without
Right,
even
okay.
knowing. From the ER and ICU perspective, untreated sleep apnea isn't just about feeling tired. It doubles your risk of heart attack and stroke, raises your chance of sudden cardiac death, and
So just being tired risks more health issues. I mean, I think certain people know that if you're always tired, it won't let your body recover properly. I don't know what this video is about.
Changes like losing weight or avoiding alcohol before
No, not the alcohol.
Machines that keep the airway open with a steady stream of air. Sleep isn't supposed to leave you feeling like you ran a marathon. If it does, definitely time to get it checked out. If you're someone who just wants a little extra support at night, I actually helped formulate a supplement called Do Not Disturb to help support natural sleep rhythms without grogginess the next day. If you're looking for better sleep, check out Do Not Disturb at lifehappens.com.
Yeah, but that's gonna be like 30
Number
quid.
5, caffeine overload. 2 cups of coffee, an energy drink, and maybe a soda sounds like a normal Monday. But add that up and you're easily over the 500
way too much.
mark. Well past the recommended.
All I need is a monster to get me through the day.
Teenagers and college students who come in pale, sweating, and shaking. Their hearts
I
pounding.
hope they don't look like that. Hang on. I hope they don't come in looking like that. What's that? What is that monstrosity?
Pounding like they just sprinted a mile, except they've only been sitting at a desk. Push the caffeine dose higher than that, and the side effects only escalate to danger territory.
I only have like 1 or maybe 2 monsters today. Not literally, but if I really need a monster, I'll have 1 or 2. But I rarely have caffeine. Yeah. So don't bother me.
Or favorite energy drink is powerful enough to kill you, so you need to be aware. Treatment depends on severity. Mild cases can be managed with fluids, monitoring, and time while the body metabolizes the caffeine. But in severe overdoses, we sometimes have to use activated charcoal to absorb what's left in the stomach, or even dialysis to pull the drug out of the blood.
Right, okay.
Number 6, holding in a sneeze. It sounds like an old what?
Holding in a sneeze. Okay.
Holding in a sneeze can actually rupture things inside your head. Sneezing builds up air pressure in your sinuses. When you hold it back, that pressure has to go somewhere. Rare but real case reports have shown burst eardrums, ruptured blood vessels in the eyes, and even brain aneurysm.
Yeah, I know someone who's actually sneezed and their eyes burst a blood vessel, but I didn't realise holding in a sneeze can do that much damage, because it eventually comes back out.
Most people get away with it, but sometimes the unlucky ones don't. Imagine stifling a sneeze and ending up with sudden hearing loss or blood leaking into your brain. It sounds extreme, but those cases do exist. If your sneeze is less of a blessing and damage does occur, treatment can range from eardrops and rest for a ruptured eardrum and emergent neurosurgery if an aneurysm.
I hope that never gets snapped up.
Often holding back something your body was designed to let out. So next time you feel a sneeze come on, don't hold it in. Grab a tissue.
Aye, Captain. But what happens if, like, hypothetically, you go to sneeze and it just stops you? Are you holding it back, or is it just going away? That is the big question. I'll leave it with that one with you guys.
Small things, right? Not always. Infections can spread shockingly fast. What looks like a little redness can turn into cellulitis.
What are we even talking about? Sorry.
So next time you feel a sneeze
Sorry.
don't hold it in.
I was too busy talking about my question.
Number 7, ignoring
normal infections.
Or worst of all, sepsis. When bacteria hit the bloodstream and your
I mean, it's common sense. An infection, you have to treat it, because eventually it will get worse.
Blood pressure tanks, organs start shutting down, and without fast intervention, you have a date with the Grim Reaper. In the ER, sepsis is one of the deadliest emergencies I see. 1 in 3 patients hospitalized with sepsis doesn't survive. It often starts with something people ignore. Then, hours later, there are multiple IV drips fighting for their life.
Yeah, but you just have to clean it most of the time.
The real key is catching it early. If an injury
Just
of
clean
any kind
it.
gets redder, hotter, or even more painful over a few days, please don't brush it off. That tiny cut could be the opening move in a life-threatening infection. Number 8, swallowing pills without water. Plenty of people dry swallow pills. Heck,
I'm sorry, I struggle swallowing pills. I don't know how you could. It just dissolves on your tongue already when you've got water in your mouth. But they dissolve. Just dry. Oh, you got no taste behind it. You just got all the pill. Oh no.
But when a pill lodges in the esophagus, it can burn a hole straight through the lining. Certain antibiotics, potassium supplements, and painkillers are in the.
Well, good thing I never go dry swallow. That sounds weird.
And that's the best case. Worst case, the pill blocks the airway and you choke to near death. I've personally had to remove tablets with a scope that were literally stuck in someone's throat, dissolving and burning the tissue around them. So treatment can.
Oh yeah, it's got like loads of acids in it.
Medications to help heal damage, or in severe cases, surgery to repair internal strictures. Something that feels so harmless, such as taking a pill, can end up being a hospital stay. Always wash pills down with a full glass of plain water. It's simple, effective, and it won't mess with your
just medication. Don't dry swallow it.
Popping a pimple in the triangle of death. Raise your hand if you've been guilty of popping a zit. We are.
Sorry. I have.
But I'm sorry to report, if it's in the wrong spot, it can be deadly. There's a reason the area from the corners of your mouth up to the bridge of your nose is nicknamed the triangle of death. Because while the veins in this zone connect directly to the cavernous sinus, a space at the base
there,
and
there.
Bacteria can get forced deeper into the skin and hitch a ride straight towards the brain. Infections that start as little red bumps can progress into cellulitis, abscesses, meningitis, or even cavernous sinus.
Oh!
A dangerous
I didn't want to see that.
Number 10, ignoring chest pain as indigestion. Chest pain at night, many people assume it's just heartburn, taking an acid, and rolled over. But sometimes it's not acid reflux, it's a heart attack. And every minute that artery stays blocked, more heart muscle dies permanently. Women in particular are at risk of brushing off the symptoms because sometimes their symptoms aren't what medical professionals call classically textbook. For instance, instead of brushing chest pain, it may feel fatigue, nausea, or even jaw pain. I treated patients who swore it was just bad food until their EKG proved otherwise. Treatment in the ER is time.
Yeah, but how exactly do you go from like just going, oh yeah, it's just food, indigestion, or something like that, to, oh yeah, it's actually serious. How do you just go, oh yeah, I'm just going to go all the time to the doctors and say, oh yeah, this is chest pain.
Busting drugs, stents to open the artery.
I don't know.
Another devastating attack. So yeah, sneezing, sleeping, popping zits can all be
for bedtime.
Are there other?
By the way, that there for his playlist looks hella weird. But anyways, I hope you enjoyed the video. I mean, this one was, I mean it was alright. I mean, I'm not gonna say anything bad about it, but I don't understand all these things that can actually kill you. That's the problem. I mean, I'll see. He seems to be a doctor, but I mean, I would say there's less of a chance of these things happening, but it was quite interesting to see what can actually kill you, I guess. But yeah, I hope you all enjoyed this video. I hope to see you in the next one. Peace out, Arby's.